I've loved watching Active Minds kind of grow into being the organization that it is today. But for everyone listening into this who probably or maybe haven't even heard of Active Minds, why don't you just take a few minutes and give us a little bit of the story so that we can have that context as we talk about what it means today?
The short version, maybe, or the longer version of my story is that I was a freshman in college. I was at the University of Pennsylvania. In March of my freshman year, my brother Brian died by suicide. He had been a college student himself who started struggling with his mental health in his freshman year, but didn't tell anybody about it until his senior year. At that point, he took a leave of absence from his school, came home. I was a senior in high school at the time. We're 4 years apart. Came home, started in really intensive treatment at home, but ended up taking his life about a year and a half later in March of my freshman year. And I was struggling through figuring out who I was, what had happened, and really more than anything, this idea that how did he start struggling with his mental health in his freshman year and not tell anybody until his senior year, not feel comfortable telling anybody. And I really reflected on the fact that nobody was talking about mental health. And when you dive into research and you find out that the age of onset of most mental health issues is the high school and the college age, Brian's story was not really unique, but the fact that nobody was talking about it meant that a lot of people were struggling alone. And so I launched what was a student group that ended up becoming the first chapter of Active Minds in my undergrad. And then when I graduated in 2003, started the nonprofit in order to develop and support other chapters of that student group. And more than anything, kind of mobilize youth and young adults to change culture in mental health. I wanted to create an environment where people like Brian knew that they weren't alone, felt comfortable reaching out for help, and got the help that they needed as soon as they needed it, and didn't have to go, what for Brian was 4 years before finally reaching out for help. And for him, by the time he reached out for help, he had already lost all hope. And I really wanted to create an environment where people could get the help that they needed before they lost hope, before a crisis could occur. So that's the genesis of the organization and where we go from one chapter in college campuses to now what we are as an organization, Active Minds, where we are on colleges and high schools and middle schools. We still have our chapter model, but we also have a number of direct to youth programs, everything from learning how to change policies in your school to bringing a speaker to your school to our suicide prevention exhibits and silence packing, all around changing social norms around mental health and creating a lifetime of change so that people feel comfortable getting the help they need as soon as they need it.
Wow, what a incredible story. I think it's a great tribute to Brian and certainly to the legacy. And I think for you, while I know we're having this conversation right now, and it is Mental Health Awareness Month, I guess in your work, it's almost always mental health awareness. So was there even 22 years ago when you started this, like a mental health awareness month?
It's such a good question. I think about this a lot of what's changed. The short of the answer is if there was one, I don't remember it. I happen to remember that they started introducing this idea of World Depression Screening Day in October. And there was a little bit of talk about suicide, but nothing that was a public conversation. I think that's been the biggest change, was that even if there was this month, the only people who were talking about it were the folks who were already really actively involved in their own or their loved ones' mental health struggles. It was not a public conversation. It was not a public health conversation. And that's really the evolution over these past 22 years. The amount that we're willing to talk about this now, while we still have a long way to go, but the amount that we're willing to talk about it as a general public, the fact that you're not part of a mental health organization and yet and you're honoring the fact that it's Mental Health Awareness Month is a huge change and growth for this field.